And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So as far as the stress that military life may put on other ones in the household, obviously it just carries on down to the children.
Absolutely. It kind of makes sense to me. It's almost just like living in a divorced family. You get some of those same emotional issues where the two parents provide a lot of emotional support, guidance, instruction, and if you don't have that, certainly the kids will suffer, especially if the kids don't get a lot of parenting. It's nice to know that it's being recognized. I do know that the military is working very hard at treating these emotional illnesses, depression, PTSD. So we just encourage our military folks to rely very heavily on the military staff to help them in those times of need. But it certainly makes sense. You need the two parents. Both of them do so many important things. It typically will suffer when one or two are gone. It's always nice to know that it can happen when one parent is there. It does happen occasionally, right. But certainly the odds are decreased if there's only one parent.
All right, on to some of our viewers' medical questions. This person asked, is sleep apnea life-threatening?
Typically it can be, especially if it's not treated, and if it's severe, I would say mild sleep apnea. Probably patients won't feel any different, maybe a little fatigue, maybe not so able to think during the day, but certainly if it's severe, it can be life-threatening because it causes electrical problems of the heart. It can cause heart failure, and those can lead to death as well. So it takes some time, but certainly get it treated if you have that condition.
Okay. This person is going for a thyroid biopsy tomorrow. What should they expect, and is there much pain, and what exactly are they looking for?
They should expect typically a non-painful situation. They typically use numbing medication. It should be very straightforward. They should have a lot of instruction prior to the procedure. They should make sure they understand the procedure and they understand what's going on, because sometimes complications arise, infections, bleeding. Sometimes you have to have another biopsy. So all that should be clearly explained. They should be comfortable with that. But in my experience, biopsies are pretty straightforward, typically low risk, and hopefully they get the results that they want.
Okay, another question. I'm not hearing out of both of my ears. I went to the ER and they said that there was nothing that they could do. What would make this occur? I have no pain and no other symptoms.
You know, hearing loss certainly can be a severe problem. They don't do the complete workup in the emergency department. They basically triage the situation and determine if it's life-threatening. Does the patient need to be in the hospital? So if your symptoms have not gone away, get back with your primary care physician. There's certainly other things that can be done. Hearing loss a lot of times means the hearing apparatus is damaged. That's the skill of the physician to try and figure out why. We rely very heavily on ear, nose, and throat doctors to help us figure that out. They have equipment in their offices to help us do that. They have special equipment that can look inside the ear. A lot of times we need steroids, very high dose, and sometimes antiviral medications to treat that. The bottom line is don't ignore it, because the longer you go without hearing, typically it is irreversible. So try to get into your physician.
Okay. I have lung cancer and I'm on hospice. They're giving me 0.5 of morphine every 4 hours, but it only lasts about 3 hours. What can they give me to take the pain away? You
know, hospice is all about comfort and making sure they're pain-free. Just get back with the hospice staff. They should be readily available to adjust the pain medication. So any person on hospice should not be in pain. We have multiple modalities in pain medicines to help them become pain-free, but it is an adjustment, obviously.
Okay. I take CellCep for an aggressive form of lupus that has really started to affect my kidneys and other organs. It also causes a lot of bone pain. An ER doctor told me yesterday that it was an extremely dangerous drug. Do you agree?
I think I would say high-risk drug. Certainly it's very strong, and treating an illness that the treating physician feels like she needs, get back with the treating physician if you have any concerns about toxicity, which in a high-risk medication like CellCep, you normally can have that. That's up to the treating physician to monitor at all costs.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. Back with Dr. Msonthi Levine to answer more of your medical questions. This person says their left heel hurts in the morning. It gets better after walking on it a bit. What could it be?
Probably a form of tendonitis. Sometimes you can develop a bone spur on the heel. It becomes inflamed. Arthritis typically behaves that way, where the pain is relieved when we walk or when we're in motion, then it's worse when we're sitting. anti-inflammatory medicines and injections can help. Sometimes shoe inserts prescribed by the podiatrist help as well.
Okay. Can low blood pressure be as dangerous as high blood pressure?
Absolutely. You know, it's a balance we try to reach when we place patients on antihypertensives, and I'm assuming they're on medication. But if not, if they have very low blood pressure, that's a sign of a lot of serious illnesses that can be life-threatening. Certainly you shouldn't let that go. You should be immediately evaluated by a medical person, preferably in the emergency department, because they have monitoring, they have blood. They can do something emergently if they find something wrong with your low blood pressure. Your brain needs pressure, and if the brain doesn't have pressure, it will die very rapidly, so it is very dangerous.
Okay. What is mesothelioma, and what are the symptoms and side effects?
It's a form of lung cancer. We talk a lot about mesothelioma, certainly with asbestosis exposure. We've done a tremendous job trying to get rid of asbestosis and limiting exposure. So it is a form of lung cancer associated with asbestosis exposure. It doesn't mean that you will get mesothelioma if you've been exposed, but the risk is high. There is no national recommendation on what to do about that. Certainly physicians, knowing that history, might do an x-ray, chest x-ray, or a CAT scan once a year. But again, no national recommendations on that.
Okay. This person was diagnosed with bronchitis. They're taking promethazine. What else can be taken?
For bronchitis, a lot of times I use inhalers like Advair. I like to use prednisone. I like cough medicines such as Tessalon Pearls. Promethazine has received a lot of bad press recently because of abuse, misuse, overuse of that medication. So physicians like me actually try to stay away from that because it's a high-risk medicine. So we try to rely on steroids, inhalers, things of that nature. I will prescribe it, but it's normally a third or fourth line.
Okay. What can cause all of the joints in the body to be stiff and sore?
Our good old friend, osteoarthritis. However, it could be a treatable form, rheumatoid arthritis, gout, lupus. So certainly we try anti-inflammatory medicines first. But if it worsens or becomes more severe, you certainly need a good evaluation to make sure you don't have those illnesses, because they do have specific treatments for those illnesses.
Okay. Another question. 2 years ago, my daughter had a period for 1 day. She's now 14. And she hasn't had one since. Is that normal, or should she be checked?
I think if she's had normal physical development in terms of puberty, probably it's okay. A lot of times patients are a lot different in terms of when they have menarche. It may skip a few months or years, but certainly if there's been normal development and everything is checked out, it's probably okay, but probably wouldn't hurt to go into your doc and get some blood work.
This person has a burning sensation in their feet. What can cause it?
You know, we couldn't go a segment without talking about neuropathy.
Exactly. We talk about neuropathy every week.
We do. It's common, and we like to talk about it. Diabetes, pinched nerve, poor circulation, medications, unknown. We have good medications. Certainly you don't have to suffer. Get to your doctor for a prescription.
Okay. I have a daughter who has miscarried twice. Should she get checked out why her body can carry it? She's been to an OB-GYN. Who can she talk to? She has no insurance.
Planned Parenthood or Medicaid. Certainly there's help out there for her.
All right. Dr. Levine, as always, we appreciate you stopping
Happy Memorial
by.
Day.
Happy Memorial Day to you.
Yes,
and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.